This program is funded in part by grants from the Foundation for a Healthy Kentucky and the Kentucky Medical Association through a grant from the Anthem Foundation.
Every day, our lung health is under threat by an array of forces: environmental air pollution, tobacco smoke and e-cigarettes, radon gas, and biological agents like COVID-19. In this program, we talk with experts about these hazards and the risks they pose to the lung health of all Kentuckians, but particularly the most vulnerable among us.
The single most preventable cause of a lot of the chronic diseases we have is our air.
This program is part of our series, Fighting to Breathe, where we examine the undertold story of lung disease in Kentucky, including lung cancer, COPD, and asthma, explore the latest advancements in treatments, and meet healthcare providers and advocates across the state who are working tirelessly to help us all breathe easier. Welcome to Fighting to Breathe, KET's three-part series on lung disease in Kentucky. I'm Renee Shaw. Every minute, our lungs are fighting off unwanted particles, toxins, and biological agents. In this episode, we examine the major threats to lung health, especially in our most vulnerable communities. We're going to begin by looking at COVID-19, which has shown us the devastating impact a virus can have when the immune system is overwhelmed. I spoke with Dr. Shanad Anangi, pulmonologist at Harrison Memorial Hospital, about what happens to the lungs during a prolonged fight with COVID-19 and the alarming rise of people who continue to experience symptoms months after infection with what is commonly known as long COVID. Dr. Srinad Anangi, thank you so much for being with us. So let's talk about what COVID-19 does to the lungs, right? What it really looks like, the damage either short-term or long-term, particularly for those who end up on a ventilator. What is happening to people's lungs during the course of the disease progression?
It's a viral disease. When it infects the lungs, it causes a lot of inflammation. In the scientific terminology, we call it diffuse alveolar damage. It's pretty much damages the whole lung itself, and in the process of the healing, the lungs can be scarred eventually. And the other things we have seen is this COVID-19 virus will also make the chance of having blood clots inside the lungs. And moreover, it's not just the disease of the lungs, it's probably the disease of the body as a whole. But as the port of entry is the lungs are the most affected, but it does not stop there.
Could you explain to us how the lungs are trying to function when they're in a whatever disease state of COVID, when it becomes that severe?
As the disease progresses, when they have this diffuse alveolar damage, the air sacs where the air gets filled and the oxygen diffuses, those sacs are filled with all this inflammatory fluid to a point where the oxygen cannot travel in between the lungs and the blood. At that point, the body is not getting any oxygen from the lungs. And that's when people will be started on oxygen initially. And as it gets worse, people need to be supported by a ventilator. And sometimes that might not be enough. And sometimes people need to be on an ECMO machine where they need to take the blood out and put the oxygen in the blood and give it back to the body. And sometimes that's not even enough to a point where we cannot keep them alive.
What do we know about the long-term damage of COVID to the lungs?
So it's an evolving topic, and we are knowing more and more every day. So now we have a specific scientific term for that, which is called post-acute sequelae of SARS-CoV-2 infection, PASC. The people call long haulers, long COVID, long-term COVID. That PAC is more scientific. So usually if somebody is having any respiratory disease or any illness, when they come to the hospital, they will be sick, but they eventually recover and back to their baseline. But that's not the case in what we are seeing with the COVID. So people are having these prolonged symptoms, be it shortness of breath or cough or loss of taste or loss of smell or fatigue, or sometimes they call these fog, mind fog, where they feel cloudy pretty much all the time. So they are having the symptoms for a very long time. So what's causing these symptoms? Is it directly from the COVID, or is it because unmasking something they already have from the COVID? How is your breathing?
I'm still having shortness of breath some.
Okay.
Very fatigued still.
At the Pulmonary Services Department in Harrison Memorial Hospital in Cynthiana, Dr. Inangi treats a wide range of respiratory issues, including those caused by COVID-19 infections. In addition to consultations with Dr. Inangi, the clinic offers state-of-the-art pulmonary function testing and rehabilitation training designed to increase muscle strength and improve lung function. Lisa Hurst is an employee at Harrison Memorial Hospital, but she's also a patient of Dr. Inangi's. She was infected with COVID-19 in December 2020.
A year ago, when they told me I had COVID, I anticipated a week. I'll be down for a week, and then I'll be back to normal. And I wasn't. I realized that I wasn't my normal self by spring. By the time it got to be warm, I was still having trouble breathing. Walking to my car at the end of the day even was a struggle, whereas before I would sometimes walk after work a mile or two, and I wasn't even making it to my car without gasping.
Lisa eventually sought the help of Dr. Inangi. He determined that her lungs were not permanently damaged or scarred in any way.
I was relieved to hear that everything was normal. There wasn't any blood clots in there. There wasn't any damage to my lungs, but I was still having the symptoms. And he basically explained to me that COVID is a disease that affects your entire body, not just your lungs, and that fatigue was probably more to blame for the shortness of breath than my lungs. What it came down to was my muscles were having to work harder to do what they were doing before, causing me to be out of breath. My message for people is take it seriously. I think you should realize that even if you are a healthy individual, it can take a toll on you. It's not something you're going to just clear in a short period of time. You know, you may and you may not.
While the science surrounding the coronavirus is still evolving, it's clear that even people with a mild case of COVID-19 can be subject to long COVID, which is one more reason to get vaccinated and avoid infection. In our next segment, we look at outdoor air pollution, both visible and invisible. Dr. Wayne Tuckson, host of Kentucky Health, talked with Ted Smith, director of the Center for Air, Water, and Soil at the University of Louisville, about the state of our air quality and a unique study investigating the connection between trees and healthy air.
Ted, thank you very much for being with us. In 1970, the Clean Air Act was passed, and in the United States, air has gotten better, but I don't think we could say that it's really all that good. At least I wouldn't want to. So what are some of the new threats that are emerging, and what impact are you seeing in terms of air quality in our health?
I mean, absolutely. We lived at a very awful time industrially, in the Industrial Revolution. I grew up in Pittsburgh, Pennsylvania, also a city that you had to have your lights on in the middle of the day if you wanted to see where you were going. And so, absolutely, we're not dealing with pollution that looks like that anymore in most of the United States, but we are learning about the whole spectrum of what we would call polluted air. And while we've definitely tackled, let's say, the pollution that you can see in many cases, though not always, we're learning that these very, very small particles, ultrafine particles, are a new frontier, not regulated by the Clean Air Act. We're learning about air toxics, volatile organic compounds, and really what their health effects are. And so while we've made progress on the things that we can see, we have a lot of work to do on the things that we can't see that we know are impairing our health. And so, that's the never-ending challenge for us.
The environmental pollutants, known and unknown, Are they affecting all of us equally, or are there certain segments of our population that are being hit more than others?
I think the word hit is a really good word, right? So, at the end of the day, when you're dealing with chronic disease, right? I'm not talking about a traumatic event, an infectious disease that might take you down immediately, but the things that accumulate over your life, hits is a great way to think about it. And so we are at some level accumulating different kinds of hits. And many people are born into circumstances or put into circumstances where there's a big ledger of hits. Maybe they're in an environment that's constantly stressful. Maybe they're in an environment where there's not adequate selection of foods, right? And then you add air pollution on top of that. And you wouldn't be surprised to know that if you've already accumulated a bunch of other hits, that hit could be the thing that tips you, right? Towards metabolic disease, towards depression, towards a whole host of things. And so, it really is a situation of some people are dealing with a shallow ledger and some people are dealing with a deep ledger. And, we really need to start doing true cost accounting of all these hits.
Well, let's take a more macroscopic view and talk about tree canopies. We know that in places where there are no trees, health indices go down and respiratory problems up,
Yep.
and pollution is up. But yet where we have tree canopies, people, what is the association? Help me, take me through this.
That's fantastic. So this parallel of we see the phenomena, we see trees and people that don't have disease, and we see no trees and people have disease, and we want to say, oh, well then, trees cause good health or something like that, right? And I think many educated or just people that are paying attention, kind of think, well, is it that simple? And, tell me exactly why that would be. So our approach to interrogating the question, does vegetation like trees cause good health or reduce disease risk? We're testing it in a very large clinical trial, community-based clinical trial called the Green Heart Project here in South Louisville. It's the only clinical trial that really is registered as a drug trial. And you will see where it would normally say the name of a medication for the intervention, it says trees and bushes. We have a collection of neighborhoods with 22,000 people that live in them, and we've divided them up into an intervention and control. So some people get the medication and some people don't. And we hope to see over a 5-year period whether the vegetation, like a drug, causes good health or not.
What wakes you up in the morning that says, I'm getting up and I'm excited to get out here and do this? That's the last thing I'm going to ask you.
Look, I think we have a tool to work with, and I'm really excited that I feel like I found a tool that looks really useful. And I think if we can work with it, and that is really look at these environments, not blame people for their circumstances, not hide from things that look like they're too hard, but essentially let's just commit ourselves to having healthy, equitable places. I mean, that's awesome, right? So I want to do that. That's what I want to do.
It's not too late.
It's not too late. Okay. It's not too late.
Ted, thank you very much for being with us.
Thank you so much.
According to the American Lung Association, 40% of Americans are impacted by unhealthy air, and the threat from deadly particle pollution increases every year. In our next segment, we turn our attention to radon gas, something that's lurking in many of our homes at high levels undetected. Dr. Wayne Tuckson spoke with Kyle Hoyleman, president of the American Association of Radon Scientists and Technologists and CEO of Protect Environmental, which tests and treats homes for radon.
Kyle, thank you very much for being with us. I think first off, tell me, what is radon?
Well, radon is a naturally occurring radioactive gas. It comes from uranium, and you can't see it, you can't taste it or smell it, so it's invisible. And at times that makes people wonder if it's real.
Why should we be concerned about it then?
We should be concerned because it's the leading cause of lung cancer among non-smokers, not only in the United States, but across the world.
This is personal for you. Tell me about your journey and your experience with radon.
First of all, I'm a cancer survivor myself.
Oh.
And I believe that my cancer may be tied to radon exposure. I grew up in southern Ohio on a tree farm. We were in that house for more than 20 years, and come to find out, the home tested almost at 30 picocuries, which is the radiation dose equivalent of almost 1,500 annual chest x-rays. High dose of radiation. In 2008, I received a call from my dad. Well, I have some bad news. I have lung cancer. And that's how he delivered it, pretty straightforward. And unfortunately, 6 months later, he was gone.
Wow.
Non-smoker, was not exposed to any other environmental contaminants that we were aware of. He was exposed to radon.
Take me through the distribution of radon here in the Commonwealth of Kentucky.
Let's start with some national statistics. The EPA would estimate that our typical home has a radon concentration of 1.3 picocuries. That is contrasted to here in Kentucky, our average is 6.7. Right now, across the country, the US EPA would suggest that around 7% of our buildings contain a radon problem. Here in metropolitan Louisville, it's 58%.
58.
If you go to Fayette County, Metro Lexington, 65%. If you go down into the Bowling Green area, it's much higher.
Wow.
Across the entire Commonwealth, it's right at 43%.
How do you go about measuring radon? How do we get those numbers?
First of all, the measurement is in picocuries per liter of air. So we're interested in the air that we're breathing. And we do that through a variety of devices. Small devices, charcoal. So we absorb what's in the air. We run that through a gas spectrometer, and we're able to analyze the gamma that comes out of that charcoal.
Okay. We go in, you do the testing, and we have an elevated radon level. Now what?
We can mitigate the occupant exposure in the home to radon. And we do that through two primary methods. By far, the most prevalent is called active soil depressurization. And just think of it being a glorified vacuum system for the subfoundation area of your home. So radon comes into the home by preferential pathways, cracks, gaps, sewer areas. And what we do is we just suck the radon out from beneath the home before it can come into the home. And then we discharge it above the home where it can dilute safely in outdoor air.
What are some of the biggest misconceptions that many of us have about radon?
We hear stuff all the time. If the building isn't located over a basement, then it can't have a radon problem. If you have a walkout basement, then you don't have a radon problem. And the fact of the matter is, if you have a source, if you have a pathway into the building, and if you have a driving force, you will have a radon problem.
Hey guys, how's school? Good. Would you like an apple?
Natalie Davenport is one homeowner who never suspected that her home could be filled with radon.
This is my dream house. My husband and I moved here about 3 years ago. This is his family's farm. He grew up on this farm, and we decided that we wanted to leave the city life. So we built this house, and we've loved every minute. Our contractor actually asked us if we wanted to put in a radon mitigation system as they were building the house, and I declined. It was a little extra money, and radon wasn't something that was really on my radar at the time. So I told him no, we'd be fine.
Thankfully, Natalie found out about a new study designed by the University of Kentucky called Radon on the Radar, targeted to 4 Kentucky counties with high radon levels.
The main goal of the Radon on the Radar study is to make it easier for people living in these 4 rural counties to be able to test their home and afford radon mitigation when high levels of radon are found.
Natalie signed up to be a citizen scientist with the study. As a citizen scientist, she received education about radon, allowed her soil to be tested by geologists from the Kentucky Geological Survey, and received a digital measuring device to monitor her radon levels.
My first radon test was a lot higher than I thought. The testing should be less than 4. That's kind of when you're in the safe zone. But our first test was over 30. So the first thing I thought of was I brought my children to this home. I built this great home for them, got them out of the city so they could grow up with all this fresh air in the country. And then our house is filled with radon. So I panicked a little bit. Everybody from the University of Kentucky, they were so kind and, you know, talked me off my ledge and they helped us find a mitigation system. I was calling to tell you about a radon study that I was
Natalie's radon levels are now within normal limits, and she's spreading the word throughout her community about the importance of radon testing.
You know, we live in Kentucky, and when you think about lung cancer, you think about smoking. And smoking is such a big thing in Kentucky. But radon is right there with it.
Hey, I understand you guys have some radon detectors.
As part of the Radon on the Radar study, digital radon detectors are being placed for checkout in community libraries in each of the 4 counties.
We have 25 kits available. Our goal would be we'd love to have the good problem of not having any kits available and people having to wait to get them, that they're that popular one day. But I think an important part of what we're going to have to do is make sure the community understands the importance of radon's danger to them and their families.
This is our radon mitigation system.
Natalie received a voucher from the Radon on the Radar study to reduce the cost of mitigation of her house. But she knows the mitigation costs are a barrier for many.
I would like to see it affordable for everyone so that everyone has the opportunity to have their home mitigated.
We're working really hard and contacting all kinds of community partners to find ways to make radon mitigation affordable and accessible to everyone. We're up for that challenge, and until we can make radon mitigation the easy and affordable choice for everyone, we won't stop.
The state of Kentucky offers free charcoal radon testing to all Kentuckians. Please visit the state's radon program website for more information. Of all the threats to our lungs, tobacco smoke is by far number 1. Smoking harms nearly every organ in the body and is a main cause of lung cancer and chronic obstructive pulmonary disease, or COPD. I spoke with Ellen Hahn, director of Breathe at the University of Kentucky, about the immense toll of smoking on the lung health of our state. You know, no one really likes to talk about smoking, and we have had the conversations about smoking in this state for a long time. It's something we must address when we're talking about lung disease and lung health. Where does Kentucky stand against the nation when it comes to smoking?
First of all, Renee, we need to talk about it because we lead the nation in smoking. Our lung cancer cases are out the roof. We have one of the highest adult smoking rates in the country still. About 24% of our adults are regular smokers compared to 14% in the country.
What role does smoking play in terms of the rates of lung cancer and COPD?
Again, Kentucky leads the nation, has that dubious honor of having a higher proportion of lung cancer cases and emphysema than most states do, in large part, because of our high smoking rates, generations and generations of smokers.
Right. Secondhand smoke. Talk about the perils of secondhand smoke and how that factors in.
Yes, it factors in a lot, because if you're not a firsthand smoker, chances are in Kentucky you're a secondhand smoker. Because we kind of have this perfect storm, if you will. I always say that Kentucky's in the eye of the storm because not only do we have high smoking rates, we have weak protections by and large. Only about 37% of our Kentuckians are covered by strong smoke-free ordinances, meaning that, a huge majority are not protected. So we have high smoking rates, we have weak laws, and we have a lot of people who are exposed to secondhand smoke at work, at home, and in public places. And youth, of course, we have an epidemic of electronic cigarette use among our kids, and 26% of high school students use electronic cigarettes. Mm-hmm. And that's no mistake because the tobacco industry has targeted them and has very slick ad campaigns about electronic cigarettes. The truth remains they are tobacco products, they're not harmless, and they're not just e-cigarette vapor.
What do we know about the effects of vaping on the lungs, short and long term?
Well, we do know that electronic cigarette use can create serious lung injury. In fact, prior to COVID, the CDC was following EVALI, which is e-cigarette and vaping associated lung injury, which is very serious, and people have died. as a result of using electronic cigarettes. Not only that, but they're very high in nicotine, so they are addictive. They also have high levels of these metal particles, which a lot of people don't realize that they're inhaling metal particles. And then the particles that come out of the aerosol are very tiny. They're ultrafine, which means that they get stuck in your lungs, deep down in your lungs, and create havoc, basically, with lung and heart disease.
Let's shift and talk about radon. We've heard about the dangers of radon in this program already. It accounts for 20% of lung cancer cases. How does smoking indoors multiply your risk for radon exposure?
Right, so breathing radon is dangerous for everyone, but it's even more harmful when you also breathe tobacco smoke. And so the estimate is about your risk of getting lung cancer by breathing both radon and tobacco smoke is about 10 times the risk.
So when you think about compounding these risk exposures, smoking, the vaping, radon, indoor and outdoor air pollution, all of these building on each other, can you talk about the idea of this co-exposure and how much more of a danger that can be?
So co-exposure, the idea of that is you may have one hazard. You may be exposed to air pollution inside from smoking, for example, and that's bad enough and that's harmful enough. But then add another exposure on top of that, and you'd think that 1 + 1 = 2, right? But it really is more like 1 + 1 perhaps equals 10.
You know, we always like to ask people, what's your why? And I want to ask you, Dr. Ellen Hahn, what's your why?
Well, it's personal. You know, I grew up in a home, both my parents were heavy smokers. I lived in a rural community in Pennsylvania and Appalachia, and we would drive down the mountain, you know, to go to synagogue, and they would smoke in the car. And I never smoked a day in my life, but I developed severe asthma. The single most preventable, really, cause of a lot of the chronic diseases we have is our air. We've got to fight for better air, you know, and we know what to do. We just need to do it. You know, we need the political will to do it.
Yeah. You think we'll get there?
I hope so. We're working hard. We've seen progress in Kentucky, and we have seen amazing results from smoke-free ordinances at the local level. I mean, it is amazing to me that fewer kids smoke in communities that have strong, comprehensive smoke-free workplace laws. And we've been able to document that. Fewer people go to the hospital for emphysema if they live in a community like Lexington or Louisville that has a strong smoke-free law. We've seen fewer asthma attacks in those communities. We've seen fewer lower smoking rates, actually. So we have some success stories to celebrate in Kentucky, but we got a lot of work to do.
For anyone who wants to quit smoking and needs additional support, please visit our website at ket.org/respiratory for more information or to watch an archived version of this program. Thank you so much for joining us for this episode of Fighting to Breathe. Remember that anyone with lungs can get lung disease. Clean air is essential to life and is something we should all be fighting for, both for ourselves and our fellow citizens. From all of us here at KET, thank you so very much for watching. Take really good care, and I'll see you soon.